about halfway through medical school, I decided to train in something called internal medicine and pediatrics. So both adult medicine and kid medicine. And that kid piece was really critical because I think as you start to go through med school, as you start to have some actual patient experiences, you realize that the real potential for impact is as early as possible, right? As early as possible in terms of the particular condition or disease, as early as possible in terms of that specific injury, but also as early as possible in life in general. And one of the things I really appreciated about pediatrics is that it wasn't just kind of catching up to illness or injury. It was actually building towards a positive future. One that comes to mind is actually seeing a young person for their just routine checkup. And one of the things we do is we talk through different aspects of their life to really figure out how things are going. And for this particular young person, it seemed like everything was not going well. Every single question, there was some sort of problem, some sort of concern. And, as a pediatrician, you can quickly get overwhelmed, right? Because suddenly in your mind, you have this really long checklist of things that you want to work on with this young person. But if you continue to ask questions even beyond that point, at some point, you find something positive, something good, a strength, an asset, a resource that you can really stand on. In this particular instance, again, there were so many things going wrong, but this young person, despite challenges in school, challenges at home, I remember he told me every single day he walked his little brother home from school because he wanted to make sure that his brother was safe. And his brother had been bullied and there were some concerns with that. And so this teenager who for himself really just wasn't keeping his act together, every single day he remembered to do this for his little brother. And I think kind of identifying that specific strength helped him to realize that he has the capacity to do a lot. And many young people, unfortunately, don't have a lot of other people in their life pointing those things out. If anything, the soundtrack of their day-to-day is really about problems and issues and things they need to do differently or better. And, as a teenager, eventually you kind of just tune that out because it's just too much. But when you're a caring adult who can then speak in something positive into that conversation, it can have a really significant impact. And so those sorts of moments to me are really rewarding because they're not fancy, they're not dramatic, but for that individual, they can make a substantial difference. And I find that really rewarding.